everyone, it's Jasmine, and today's video is all about medication safety and how we can reduce medication errors. I hope you learned something today, and let's get started. Okay, so why does medication safety matter? Medication safety is a critical component of healthcare quality and patient outcomes. Medication-related harm is one of the most common preventable causes of patient injury in healthcare systems worldwide. In addition, safe medication practices rely on both individual vigilance and diligent healthcare policies and practices. So throughout today's video, you will notice that I will be speaking a lot about practices that go on in hospitals and in the overall healthcare system. But these practices actually can and should be followed at home too, if you are self-managing your medications or say managing the medications of a family member or a loved one, as these practices should and can be followed in all settings. Now, first of all, what are medication errors? A medication error is any preventable event that may cause inappropriate medication use or patient harm. Now, again, I say patient as I'm talking about within the healthcare settings, but individual harm or harm to whoever is taking the medication. Errors can occur at any stage, whether it be at when the medication is prescribed, when it's transcribed at the pharmacy, when it's dispensed from the pharmacy, or from the medication storage in your home or in hospital, when it's administered, and when monitoring occurs. Most errors are multifactorial rather than the result of a single mistake. Now, the healthcare system's approach to safety is crucial in preventing medication errors. Medication safety is not only about individual performance, so the performance from nurses, doctors, and so on, but it depends on system design. Factors like workload, workflow design, staffing levels, and communication systems significantly impact the risk for error. So improving safety requires addressing root causes and not just individual actions. Now, important for us to speak about is high alert medications, which are certain medications that carry a higher risk of causing significant harm if they're used incorrectly. These include insulin, anticoagulants, opioids, and chemotherapy agents, to name a few. For these medications, extra safeguards such as independent double checks, so confirming not only with yourself, but say another family member who's in the home with you, or for the hospital setting, having two nurses double check medications before they're administered, and other standardized protocols can be essential to maintain safety. To add to the confusion, there can also be similarities between medications. So this might be between medication names, the packaging that it comes in, or labeling similarities on this packaging or the vials, etc. All of these things can increase risk for error if we're not taking our time and paying attention. Other examples also can include medications with similar spelling or the sounds of the medication. An example of this would be Celebrex and Celexa. So one of these medications is used to treat arthritic pain and inflammation, and the other is actually an antidepressant. So as you can imagine, these have two different effects on the body, and it's important that you are taking the correct medication for its correct use. Strategies to reduce risk include barcode scanning in hospitals. So what happens is when a nurse pulls a medication from their medication drawer for a specific patient, they should be required to scan a barcode on that patient's wristband, have the patient tell the nurse their name, date of birth to confirm that it's the correct patient, and then scanning the medication bottle or vial or whatever the packaging is that it comes in, and making sure that this aligns with the patient and the medication and the time at which they're supposed to be taking this medication. But we will talk more about this in just a little bit. Now, medication reconciliation is also a very important process that can allow us to reduce risk for med errors. Medication reconciliation ensures accurate and complete medication information across transitions of care. So say you were in the hospital at one point and then you were discharged and had a doctor's appointment after that, and then you were sent home and told to go to the pharmacy. The way a medication reconciliation works is it is completed and sent to all healthcare providers to make sure that during these individual stays or appointments, everyone is on the same page of the medications that are being taken to reduce overlap, to avoid the prescription of any medications that may interact with other medications the individual's taking, and so on. While the example I just gave is again specific to the healthcare system and different physicians and prescribers, this process can also be done independently by comparing your current at-home medications, everything that you take, with a list received from your doctor's office of what the orders are for your meds and what you should be taking. If there's any confusion between the two, it is very important that you're booking with your physician to sort this confusion out and reduce the risk for any errors or adverse effects. Now, to support safe medication administration, there is a guideline and practice that healthcare providers follow, specifically nurses who in hospital are directly involved with medication administration, but this guideline can be applied in your day-to-day life as well. And the guideline is following the 7 rights. So the 7 rights are making sure the medication is given to the right patient, it's the right medication itself, it is the right dose, so checking to see that your packaging matches the doctor's orders for the dose you're meant to be taking. You're taking it via the right route, so making sure that if you're supposed to be taking a medication orally, it is not provided in a IV bag, for a very general example. It's taken at the right time, so if your medication is prescribed in the morning, you're taking it in the morning, and you're ensuring that it is correctly spaced out with when you took the last medication. For example, say you were prescribed an opioid for pain management and your prescription says to take it every 4 hours, you're making sure you are taking it every 4 hours and not any sooner or later. Right documentation is important specifically in a healthcare setting, but it can be extremely important at home too. If you have a lot of medications to track, you can have a little list in front of you and say you take your cholesterol medication in the morning, you check it off, and that ensures that you're not going to be taking it a second time or forgetting that you did take it and doubling your dose. And then you're taking it for the right reason. So say you are prescribed a painkiller and you find that you actually can go without that medication and you're pain-free. Maybe that means you need to have a conversation with your physician to see if you're still needing to be on that medication, because maybe things have changed and your pain's improved and it's no longer necessary. Now, human factors in technology and medication safety can play a key role. Medication safety is influenced by human factors such as fatigue, distractions, interruptions, and workload. This applies again in the healthcare setting, but it also applies at home. If you're in the middle of taking a bunch of medications and someone comes into the room and starts talking to you, are you going to be able to remember what medications you've taken, where you were at in your regimen, and so on? At the same time, technology, for example, the barcode scanning example I had given earlier, improves safety, but it also can introduce new risks like alert fatigue or selection errors. Because technology is not perfect, it might be saying this is correct when it may not be correct and the patient may not need that medication. So it's really important that we're always using our own judgment as well. Safe practice requires balancing human limitations with well-designed technological systems, in summary. Now, a very important point here that I want to talk about is just learning from medication incidents, because they can happen and they may happen. So incident reporting and near-miss documentation is essential for improving patient safety. This is especially important working in the healthcare system. If a nurse makes a mistake or whoever makes a mistake, it's important that we're being honest about that and we're not trying to hide it. We're coming forward just so we can make sure that the patient is safe and is getting any necessary treatment or monitoring that they need. To allow for the comfortability and safety for these individuals to come forward if a medication error does occur, we have to create a culture that encourages transparency and reporting without blame for unintentional errors. Analyzing these incidences in the healthcare system and even at home can help make sure our systems that we're using are safe, or if there are any gaps, we can address them to prevent recurrence of the incidents. Overall, medication safety is a shared responsibility across the healthcare teams, but also across the individuals, the family, and loved ones of who is taking the medication. Continuous education, communication, and quality improvement initiatives strengthen safety practices. A strong safety culture prioritizes prevention, accountability, and ongoing learning, and makes sure that we are keeping one another nice and safe and healthy. Thanks for watching.